Once again to answer our latest questions about the coronavirus pandemic here in Kern County and across the country. Dr. Kothary, Chief Medical Officer for Dignity Health Central California Division. Dr. Kothary, thanks so much for joining us this morning, sir.
Oh, thank you for having me again, Maddie.
All right, I want to first talk about the story we just mentioned and the cases and the outbreak at the Kingston Healthcare Facility. More than 100 people there, staff and residents, have tested positive for the virus. There have been 9 deaths, and that's the majority of the county's deaths, and that's all at one facility. What can be done at nursing homes to mitigate the risk?
You know, I think a lot of them already have done that, and they've shut the nursing homes down to any kind of guests and visitors. Which is, you know, not a good thing, obviously, for if you have your family or loved ones in there. But I think one of the things that we could do is, if when this happens again, is test all the residents in the nursing homes and see who do have it, and then you can quarantine just those people.
Because we're talking about, you know, what happens going forward. If we assume that this virus is never going away, yeah, when is it safe to allow family to visit their loved ones again?
And so, you know, CDC has specific guidelines. And so, you know, it's actually, they've loosened their guidelines a lot. So if you have no fevers for 7 to 10 days and you're asymptomatic, you can come in and visit your family because you're at that point not contagious at all.
Are we going to continue to see outbreaks like this, though, happen and pop up in nursing homes across the country?
Yes, and I think, you know, if you remember when this all started in the Pacific Northwest, it actually started in a nursing home. And those are the clientele that are perfectly set up to pass this along. You know, one, they're elderly, they have other conditions, and they're living in close quarters.
Let's go on now to the outbreak widespread across the country. And yesterday, the president said that the numbers are coming down rapidly all across the country, but the numbers don't really seem to report that or support that, rather. The data from a May 7th, so a few days ago, coronavirus task force report are at odds with that, showing data from the CDC that says the rate of new cases overall. So what are we seeing here? Are we seeing yet another rebound kind of spike from everyone beginning to slowly reopen?
No, I think what we're seeing is if you look at day over day, the number of cases in the country have pretty much stabilized. And so we're not getting a lot of new cases, but we're not going down that decline path. You know, the way it works is when you're going up that peak, it takes a while to get up there. And then once you flatten out and you start to come down, it takes a while to come down too. So we're still on the flat part of the curve. We haven't started declining quite yet.
Should we be looking at the total number of cases added now that testing is ramping up? I mean, here in Kern County, we've got 6 new testing sites that we're expecting to open by the end of the week. So are we going to continue to see more and more cases, but perhaps the death rate and the seriousness of those cases being lower?
I believe so. And I think I mentioned this yesterday. I think one of the things we have that works in our favor in this county is our weather. You know, as we warm up, you should see the number decreasing. You may see a more asymptomatic or mildly symptomatic people come up in the next week or two. But I think after that, we should subside significantly.
All right, let's talk about coronavirus in kids, because so far, everything that we've heard and all the data seems to show that severe illness in kids from COVID-19 is very rare. But JAMA Pediatrics just published a new report and research yesterday on severe illness in kids, and it shows that certain ones are more at risk to getting that severe illness from COVID-19. Which children are most at risk?
You know, we haven't identified exactly which children. We do know kids that have a certain kind of heart condition called Kawasaki's disease look very similar to these kids that get infected with COVID. And what this COVID virus is doing is it's causing inflammation throughout the body. It is affecting the heart. So these kids do end up with heart conditions as well. And we've kind of known that about COVID in the past, and that's one of the reasons when we're using hydroxychloroquine, we were adding it to something called Zithromax, which we all know about. The Zithromax was not to help alleviate the virus, but it was to help alleviate the inflammation that the virus caused. So that's what the virus is doing in kids right now.
Is it still considered very rare in children?
It is. You know, we've seen a small number of cases back east, and you know, you see scattered cases here and there throughout the country, but not too many. So still relatively rare.
And Dr. Kothary, really quickly, because we are out of time here, but you have a message for people about going to the hospital to get treatment for severe illnesses if they're in need.
Yeah, I can't encourage this enough. I think, the people out there are scared. We were scared in the beginning. We now know how to handle this virus in the hospital setting. We at Dignity Health have taken every single precaution to make sure that if you come to our hospitals, you are going to be safe. We're protecting you from us us meaning the healthcare workers, wearing as much PPE as possibly we could. We're testing the patients that are coming in for surgery that need testing. And when we can, we're only limiting it to certain areas of the hospital where we don't have COVID patients at all. So very safe to come into the hospitals. If you need your surgery done and you need it now, don't push it off any further.
All right, Dr. Kothary, thank you so much for joining us again this morning, sir. We appreciate it.